Good evening, everyone, and welcome to today's webcast, How to Overcome Common Insurance Barriers. My name is Corinne Pettit, and I will be your moderator for tonight's presentation. Before we begin, I would like to go over a few items so that you know how to participate in today's event. We've taken a screenshot of the attendee interface. You should see something that looks like this on your own computer desktop in the upper right corner. If you've joined the presentation listening using your computer speaker system by default, this means if you can hear music through your computer, you should be able to hear the presentation. If you prefer to join over the telephone, just select Use Telephone in the audio pane and the dial-in information will be displayed. You will have the opportunity to submit text questions to today's presenter by typing into the questions pane of the control panel. You may send in your questions at any time during the presentation, and we will collect these and address as many as possible at the end. Before I introduce today's speaker, I'd like to take a moment to tell those of you who are new to the Foundation about who we are, our mission, and what we do. The National Psoriasis Foundation is the world's largest nonprofit patient advocacy organization dedicated to psoriasis and psoriatic arthritis, and we serve as a voice for millions of Americans who are affected by these diseases. Our mission is to drive efforts to cure psoriatic disease and improve the lives of those affected. In order to move our mission forward, we engage thousands of volunteers around the country in activities that will lead to a cure. For more information about these opportunities, log on to our website after today's program at www.psoriasis.org. One of the ways we drive our mission forward is through our Patient Navigation Center. Our team of patient navigators can help you find specialists, access new medications, and connect you to others in your community who are living with psoriatic disease. I'm excited to announce that our Navigation Center is offering free health insurance quick guides throughout open enrollment to teach individuals the basics about health insurance and how you can pick the best plan to save money on prescriptions and other healthcare services. To take advantage of this opportunity, please visit the link at the bottom of the slide or call 1-800-723-9166. Finally, I'd like to thank our sponsors, AbbVie, Celgene, Janssen, Lilly, and Pfizer for making tonight's presentation possible. Today's webcast is the second in a three-part series of webcasts that is focused on health insurance and the barriers to accessing health care. Our next webcast in the series will broadcast on November 16th and focuses on how NPS advocacy team works to fight against insurance and these barriers through state and federal legislative work. You can sign up for future webinars and watch previous ones for free on our website at psoriasis.org/webcast. Now I'd like to introduce tonight's speaker, Natalie Taylor. Natalie is a patient navigator at our Patient Navigation Center. She recently graduated from Sarah Lawrence College with a master's degree in health advocacy. Before beginning her graduate studies, Natalie worked as an in-home caregiver for 2 quadriplegic patients. This experience taught her a great deal about living with a chronic disease, the struggles that those living with a chronic disease face, how resilient people can be, as well as how to help people feel knowledgeable and empowered about their health. Her work as a caregiver inspired Natalie to pursue graduate education so that she could become a health advocate. We're very happy to have you speaking with us today. Welcome, Natalie.
Thank you so much, Corinne. So I'm going to go ahead and get started here. Let me see. I'm trying to advance the slide here. Give me 1 second. Oh, here we go. Perfect. Okay. So today we're going to be focusing on 3 main things. So we're going to talk about what you should consider when you're shopping for health insurance. We're going to talk about some common access issues and ways that you can break down these issues, including finding a healthcare provider, prescription drug coverage, and high out-of-pocket costs. And then we're also going to talk a bit about some programs and financial assistance options that might be available to you to help reduce your out-of-pocket costs for your treatments. So we're talking about these things today because health insurance is often really complicated and can be challenging to navigate. So most of us with chronic illnesses have spent a good deal of our time trying to understand why something is or isn't covered on our plan, and have spent a lot of time looking into how to access our treatments more affordably. So really the purpose of today's webinar is to help you identify some of those most common access barriers that psoriatic disease patients face, and to understand what options might be available to you to overcome those barriers. And then we want to advise you on who to go to for assistance if you're running into any roadblocks with your health care. So please feel free to write in your questions during the webinar. I'm going to try to get to as many of them as I can during the Q&A portion. And I also want to encourage you to reach out to us here at the NPF Patient Navigation Center. You can contact us by phone, email, text, or chat, and you'll get connected with a patient navigator who can help you with your specific health insurance situation. Okay, so just to start out on the ground floor, I want to talk a little bit about what health insurance is and how people access it. So in general, when you have health insurance, you pay for a plan, and then that health plan helps you pay the costs for your health care. So there's three main ways to get health insurance. Commercial plans, which is often through people's work or bought independently. And then there's also Medicaid and Medicare. So keep in mind that these are just the main ways to get health insurance. There are also some other types such as VA Health, TRICARE, Indian Health Services, and we're not going to go into detail about those types of insurance today. But if you have these other types of health insurance and you have questions, please reach out to us here at the Navigation Center, and we'd be happy to talk through your plan and any issues that you're having. So right now, it is currently open enrollment for commercial plans on the marketplace, as well as open enrollment for Medicare. So I thought I would take a minute to talk about a few things to keep in mind when you're shopping for health insurance. So one of the biggest insurance barriers that people face is having a plan that just doesn't match your needs. And so we encourage people who have the opportunity to take the time to really shop for plans and look into their options. So the first thing you want to think about when you're selecting a plan is anticipating really how much you're going to use your health insurance. So thinking through the number of times you go and visit a healthcare provider, thinking about if you've got any upcoming kind of major health costs like hospitalizations or surgeries, and then thinking about other services you use. Maybe you see a physical therapist every week, or maybe you get regular lab work. And so you really want to kind of assess how much you're going to use your plan, and that's going to help you think about what level of coverage you need, and it can help you pinpoint certain services that you utilize really often, and then you can compare how those things are covered on your various plans. Another thing to keep in mind is it's a good idea to make a list of all the prescription drugs that you'll be using so that you can kind of check in to see how they're covered on the plans that you're comparing. So most plan searches allow you to put in your prescriptions and get an out-of-pocket estimate. So I really recommend using this feature on the Marketplace website, and there's also a feature like this on the Medicare Plan Finder. So another thing to consider is whether a high or a low deductible plan might be a better option for you. So a high deductible plan typically means you're going to pay more upfront at the beginning of the year before your plan starts covering services and treatments. And these plans often have lower monthly premiums than low deductible plans. And it just sort of depends on you and your situation, which one of these options might be a better fit for you. I also encourage you to reach out to people who can help you in your search. The process of shopping for health insurance can be really overwhelming, so it's important to keep in mind that help is available. So whether you're shopping on the marketplace, independently, or for a Medicare plan, there are trained professionals who can help you kind of sift through your options. So for most people shopping for health insurance on the marketplace particularly, there are subsidies available that can help with the cost. So these subsidies can help lower the monthly payments. They can help lower out-of-pocket costs, including deductibles, copays, and coinsurance. And the amount of cost savings that you'll be eligible for is based on your household size and income. It's especially important this year for you to really shop and compare plans and to not just pay attention to that monthly premium sticker price for a treatment, but to really kind of click through the options available and get an estimate of your total yearly cost with your prescriptions put in there. Because sometimes the plans that at first glance look like they might be the best fit for you end up not being the best fit once you kind of dig into some of the details. So this table here, it shows the 2017 income ranges that would qualify you for a subsidy on the marketplace. So these subsidies are available for people who are between 100% and 400% of the federal poverty line. And so that means you would be eligible to get help with the cost of your health plan if you were shopping on the marketplace. These ranges are slightly higher for Alaska and Hawaii, but these numbers are true for the other 48 states. So we find that most people who shop on the marketplace are eligible for some level of subsidy. And it is pretty easy to go onto healthcare.gov. You'll be prompted to enter your zip code, your household income, and then it's going to tell you the level of subsidies that you're eligible for, and then you can really spend some time and look at the different plans. So we're going to jump into talking about common access issues now, and the first one we're going to be talking about is finding a healthcare provider. So one of the most common access issues that we hear about a lot from people is trying to find a healthcare provider that will accept your health insurance. So to better understand this issue, it's first important to know the difference between in-network and out-of-network providers. So an in-network provider is going to have a contract with your health plan to provide healthcare services. And when I say providers, this can be, a doctor or a specialist. It can also be a clinic or a hospital, and also some suppliers that your health plan might have contracts with, like pharmacies and medical equipment companies. So if you are someone with commercial insurance, your plan type is going to determine your access level to out-of-network providers. So if you have a commercial plan that is an HMO style plan, that means that your health plan is only going to cover in-network providers. And it also typically means that you're going to need to get a referral from your primary care doctor to see any of the in-network specialists. Now, if you have a PPO plan, this means that your health plan, you have a little bit more flexibility. You can see in-network providers, of course, and you can also see out-of-network providers, but there's going to be less coverage from your plan for seeing those out-of-network providers. Also, on these plans, you typically don't need to get a referral to see a specialist. If you are someone with a traditional Medicare plan, you do need to make sure that you're seeing a provider that accepts Medicare. And if you're somebody who has a Medicare Advantage plan, it's going to function a lot more like those commercial insurance plans I was just talking about with the HMO and the PPO coverage. So you want to pay attention to in-network and out-of-network providers. And then if you're someone who has Medicaid, you will want to make sure that you are seeing a provider that accepts your specific Medicaid plan. So if you are looking to see what providers are in-network or out-of-network for your health plan, I recommend that you contact your health plan. So calling the customer service number on your health insurance card can be a great start. You can also visit your health plan's website. They often will have provider directories on their sites, the site for your health plan. And that can be a great place to look for particular types of providers that you're interested in. And then we always recommend that when you're scheduling with a new provider that you confirm with the office that they do accept your specific health plan. It's just always best to verify. And we are always happy here at the Patient Navigation Center to help you look into options for providers in your area that are covered by your health insurance and also have experience treating psoriatic disease. So if you are someone who is not eligible for Medicare or Medicaid and the options on the marketplace are still not affordable, there are ways to access health care without health insurance. So if you're currently uninsured and you're looking for a health care provider or treatment options, we do encourage you to reach out to us here at the Navigation Center. We can help you look into the options in your area, look into clinics or health care providers that offer cash paying discounts. Because when you're searching through the different provider options, it is important to think about the difference in services that might be offered at each of these locations or clinics. Some of them may be able to refer you to specialists, including dermatologists and rheumatologists. So we would be happy to help you look into your options here. So the next access issue that we're going to talk through is understanding your prescription drug coverage. So one of the most important things to understand about how medicines or drugs are covered on your health insurance plan is understanding your drug formulary. So a formulary is a list of drugs that is covered by your health insurance plan And so that is going to be the drugs that your particular plan has agreed to cover. So the drugs in this formulary are organized into different tiers or levels, and a drug on a lower tier is generally going to cost you less than a drug on a higher tier. So this here is a common tiering structure that we often see. Your plan might have a slightly different tiering structure, but again, the lower tiers are going to be, generic drugs or preferred brand name drugs, and then the higher tiers are typically going to have the specialty drugs in it, and biologics are often in this specialty tier. So to find your health plan formulary, which I really recommend finding the formulary for your plan and taking a look at it and having access to it. A great place to do this is by visiting your health plan's website. They would have the formulary available to you there. You can also call the customer service representative on that phone number on your health insurance card and ask them if the drug or drugs that you and your doctor have been talking about are covered on your plan and what tier they're covered at. You can also request a mailed copy of your formulary, but it's important to keep in mind that drug formularies do change from time to time, and so you want to make sure that you're looking at an updated list. So next we're going to talk about prior authorizations. So when you're thinking about treatment options for psoriasis and psoriatic arthritis, it's common to hear that your treatment is on a specialty tier. So treatments on specialty tiers often require something called a prior authorization, even if that treatment is listed on your formulary. And so a prior authorization is when your healthcare provider needs to submit a form and get approval from your health plan for a prescription before it will be covered. So most of the time with a prior authorization process, you're not going to need to do anything for this process to take place. Your healthcare provider and your health plan will take care of all of the steps. But essentially, your healthcare provider will complete and submit a prior authorization. Your health plan will either approve or deny coverage for that treatment. And if you're approved, then you'll get your prescription and you can get it filled. And if you're denied, then you're not able to fill your prescription. And then you've got the options of you can work with your healthcare provider to decide on a different treatment option, or you can work with your healthcare provider to appeal that denial. So if you run into any issues with getting a prior authorization for treatment, we recommend that you first follow up with your healthcare provider to check to see that a prior authorization was submitted. Also following up with the health plan to find out if they received that prior authorization, and then to find out if it was either approved or denied. And it's important to find out if it was denied, the reason why, so that you can work with your healthcare provider if you want to appeal that decision or understand what other treatments would be covered. We also have some great resources here at the Patient Navigation Center, including template appeal letters. So we encourage you to reach out to us if you and your healthcare provider run into any roadblocks in this process. Next, we're going to talk about step therapy. So step therapy is also known as fail first, and it's when your insurance company requires you to try a less costly or a lower tiered drug before the one that you and your healthcare provider have decided on. So when you experience step therapy, we would love to hear from you. We have template letters and information here in the Navigation Center that can help you and your doctor make the case that the treatment that you decided on is medically necessary for you. So, when you experience step therapy, you can work with your healthcare provider to submit an exception to that step therapy. You want to make sure that your healthcare provider has all of your past medical records and is aware of the previous treatments that you have tried and how they've worked for you. And then we also really encourage you to work with our NPF advocacy team towards implementing state step therapy legislation. So this is a screenshot of our step therapy website, and it provides more detailed information about what step therapy is and the work that our NPF advocacy team is doing on step therapy legislation in the states and throughout the country. So there's information on this website about how to get involved, how to share your story, and becoming an advocate against step therapy in your state. I also highly recommend tuning in for the third webcast in this series on how the NPF addresses insurance barriers, and that one again is scheduled on Thursday, November 16th. Okay, so now we're going to talk about when your drug is not on the formulary. So there's also the possibility that the drug that you're trying to access is just not on your formulary at all. And this doesn't necessarily mean that you can't access it or that your health insurance won't cover it. There's still a few options to look into when it comes to a drug not being on a formulary. So the first thing you can do is work with your healthcare provider to submit what's called a formulary exception. And this would require your doctor to submit a request to your health plan to cover a drug that is not on the formulary. It typically requires an explanation as to why this drug is medically necessary for you. So for example, if you have other health conditions that make this particular treatment the best fit for you, or if you've tried and failed the other covered drugs on the plan. There are also patient assistance programs that are offered by separate foundations from drug manufacturers that can help with financial assistance to help you access these treatments. And we're going to get into more detail about different programs and financial assistance later on in the webcast. And then lastly, you can work with your healthcare provider to decide on another drug that is on your formulary. So the final option is you can decide if you'd like to pay the full out-of-pocket cost for the drug and then request a reimbursement from your insurance plan through a formulary exception. This does not guarantee that they will reimburse you, and so it's really only a good option if the cost of your treatment is affordable for you in case that reimbursement doesn't take place. Okay, so now we're going to talk about when your drug is on one of those high tiers that we were talking about. So if your drug is on a high tier and your plan's drug formulary, of that drug formulary, and you find that it's still too expensive for you to access it, there are a few options to look into. So you can work with your healthcare provider to submit what's called a tiering exception. And a tiering exception typically includes you and or your healthcare provider submitting paperwork to your health plan requesting that they bill that treatment at a lower tier cost so that that treatment can be accessed affordably by you. So we, again, have some templates here at the Patient Navigation Center that can help you and your healthcare provider write these letters requesting a tiering exception. And there are also sometimes manufacturers' coupons or programs available to help you afford treatments, and we will discuss those different financial assistance options and coupons in a little bit more detail later on. So high out-of-pocket cost is the next topic of discussion. So it's important to remember that there are different costs associated with your health insurance. So you've got your premium, which is the amount that you pay typically monthly, but sometimes quarterly or annually. And that's the amount you pay to keep your health insurance. And then you have this bucket that is sort of the out-of-pocket costs. And that's the money that you're paying for your healthcare services. And that includes your deductible and then any co-pays or co-insurance. And so the deductible is the amount that you need to pay before your health insurance kicks in and starts covering. Co-pays are typically flat rate fees that you pay. For example, if you were to go in and see your primary care doctor, you might have a $15 copay. And then co-insurance is a percentage of a service that you're responsible for. So you might, on your plan, be responsible for 20% of a hospital visit. So when you are dealing with high out-of-pocket costs, you want to make sure that you're paying attention to what you're going to be responsible for with the plan that you have. For example, plans that have high copays for doctor's visits might not be a good option for somebody with psoriasis who's going into their dermatology office multiple times a week to get light therapy. Those copays can really add up quickly, and so it's kind of something to think about. If you do have the option to shop for plans, to think about, what are the things that are making your out-of-pocket costs high, and are there other plans available that might make those costs lower for you. Another thing to pay attention to is the EOB, or the explanation of benefits. This is a letter that you're going to get in the mail from your health plan anytime after you receive healthcare services. A lot of times it'll say big at the top of the piece of paper, this is not a bill, and essentially it's a sheet of paper that's going to explain what the cost of the service that you received was, how much the insurance company is going to cover of that treatment, and then what your responsibility is. And so it's really helpful to pay attention to these EOBs. I know a lot of times, we get these in the mail, it's not the bill, so we sort of set them aside and don't take a close look at them. But they really do have a lot of great information on them, and they can help you kind of anticipate upcoming bills. They can also let you know how close you are to meeting that deductible, and also how close you are to meeting your out-of-pocket maximum if you have a plan that has a maximum to the amount of out-of-pocket costs you'll be responsible for in a given year. So when you are considering out-of-pocket costs, it can also be helpful to compare prices for different healthcare services. So it can be challenging to shop prices from place to place or provider to provider, but you can call and talk with the billing department at your doctor's office or at a healthcare facility and find out if they're able to give you an estimate of what you might expect to be charged. We do see that prices can vary greatly from place to place. For example, we've talked to people who have found that phototherapy treatments, might be more affordable at one location than another. So some commercial plans allow you to set aside a portion of your earnings to spend on healthcare costs, such as copays. These are often called health savings accounts or a flexible spending account, and the money in this account would not be subject to payroll taxes. So depending on your plan, there would be a limit to how much you can contribute to these accounts. And it's also important to pay attention to the specifics of your plan to make sure that you understand what healthcare expenses you can use it for, and also whether the balance can be rolled over to the next year. So the final access issue that I'll be talking about today are ways to lower costs that are particular to Medicare. So there are 4 different Medicare savings programs. They have different eligibility requirements. The eligibility for these programs is based on income and assets, and these programs can help with Medicare Parts A and B premiums and some other Medicare costs. For more detailed information about these programs to see if you might qualify, these programs are typically available to people who have lower income and asset levels. But we recommend that you reach out to us here at the Patient Navigation Center, or you can also contact your state Medicaid program to find out more about these Medicare savings plans to see if you might be eligible for them. So another program that's specific to helping reduce the Medicare prescription cost is Medicare Extra Help. So this is a government-based program that helps with Medicare Part D, or the prescription drug coverage for your Medicare plan. This can help with your Medicare Part D premium, the deductible that's included in a Part D plan, and it also greatly lowers the cost of prescription drugs. So the eligibility for Medicare Extra Help is also based on income and assets, but it's important to read the fine print a little bit with that. Some of the assets would be included in this and others wouldn't. So your primary residence and one vehicle, for example, would not be included in counting your assets when looking at eligibility for this program. So it is recommended that you apply for extra help if you are kind of near these eligibility guidelines, because there is the possibility that you could qualify for partial extra help. So those prescription drug prices there on the last slide, those are the prices for full extra help, but there is also a program that's partial extra help that can also really hugely reduce the amount of out-of-pocket costs you're having for prescription treatments. So for people who have high prescription costs in a given year, it's also really important to understand the Medicare donut hole. This can help you anticipate, what your out-of-pocket costs might be for a year, and really to understand that your out-of-pocket costs might be quite different at different times in the year. So typically there's generally 3 stages of coverage after you meet that initial deductible you have with your Medicare drug coverage. And so the first stage is going to be your initial coverage, which is going to kind of look like what you would anticipate your drug coverage to be. And then once your health plan has paid $3,750 for your covered prescriptions, that's the 2018 number. So once your health plan has paid that $3,750, you're going to reach the coverage gap, which is also called the donut hole. So in this stage, you can expect to have a higher out-of-pocket cost for your treatment. So in 2018, during this phase, you would be responsible for 35% of the cost of most brand name prescriptions and 44% of the cost of most generic prescriptions. So after this phase is the catastrophic coverage phase, and you'll get to this phase after you have paid $5,000 in total out-of-pocket cost for your prescriptions during that calendar year. So once you have paid $5,000 out of pocket, you'll be in this catastrophic coverage phase, and you will only have to pay a small coinsurance amount or copayment for your covered drugs for the rest of the year. So once you're in that catastrophic coverage, you'll see your out-of-pocket costs will be dramatically lower than they are in that donut hole. And so this process resets at the beginning of each calendar year. One of the provisions of the Affordable Care Act is that the donut hole will be closing, and so by 2020 we expect this donut hole to be closed. It's particularly important to understand this. I know it's a little bit complicated with the different stages, but I think it's an important thing to understand because we hear from people really often who very reasonably get a bill for the cost of their prescription while they're in this donut hole period and are very alarmed by having such a high out-of-pocket cost for their treatment, thinking that it is going to be that way every month for the rest of the year. And so it's important to understand if you're in the donut hole or not and how close you are to getting out of it so that you can really anticipate your cost for the whole year. So another Medicare-specific resource is the state pharmaceutical assistance programs. So these can be a good option for reducing prescription costs if you aren't eligible for Medicare Extra Health. So currently 21 of the 50 states have some sort of state pharmaceutical assistance program. These programs vary widely from state to state, but it's a good resource to look into to see if it's something that you might have access to. So some states have programs that are only accessible to people with certain health conditions, while other states, such as New York, have more robust programs. So some treatments have the ability to be taken either as an infusion or an injection in a clinic or as a self-injection at home. So if you have Medicare, these two ways of accessing the same treatment might have significantly different costs for you depending on your plan. So if you're taking a treatment that can be administered in multiple ways, such as Stelara or Symphony, you can contact your health plan or the drug manufacturer and find out how your treatment is currently being billed, and they can help you determine how to access your treatment most affordably to find out, if it might be more cost efficient for you to get this treatment billed through the medical portion of your coverage or the prescription portion of your coverage. So finally, we are going to talk about the programs and financial assistance that might be available for you for treatments. So these include different types of coupons, co-pay discount programs, patient assistance programs, and also foundations. So depending on the type of assistance, there's going to be different eligibility requirements for these various options. And so I'm going to go into some of the details in the next few slides, but please feel free to contact us here at the Patient Navigation Center if you're having access issues with your treatments, and we can help provide you with more individualized assistance. Okay, so there are coupons that can be used on over-the-counter products such as moisturizers, shampoos, etc., and that can help make them more affordable. You can get these coupons from the drugstores or supermarkets where you're accessing them, or also there are direct manufacturer coupons, and I've put some links here on this slide that might be helpful. So there are also different types of programs that can help you access treatments at a lower cost, and these include copay discount programs, patient assistance programs, and foundations. So first up, copay discount cards are available for some medications, including the biologic treatments for psoriatic disease, and they are available for people who are 18 years and older and who have commercial insurance. So these cards offer access to expensive treatments to patients by covering all or the majority of the copay that you would be responsible for. So if you're commercially insured, we encourage you to go to the manufacturer's website for the treatments that you're on to see if they offer a copay card like this. As always, you can also reach out to us here at the Patient Navigation Center, and we would be happy to connect you with these resources. So some insurance plans may not accept these copay discount cards offered by manufacturers, and if you're experiencing this issue, again, we encourage you to contact us here in the Navigation Center, and we can help you look into the situation and your options. So there are also patient assistance programs for many of the treatments that are offered by separate foundations, and they provide prescriptions at no cost for people who qualify. So eligibility for these programs is income-based, and it varies from program to program. Some of these programs are accessible to Medicare patients depending on their coverage, and so we recommend that you reach out to us if you're having trouble affordably accessing your treatments, so that we can help you look into all of your options, including identifying if a patient assistance program might be a good option for you. Okay, so there are also foundations that provide individual grants that help cover health costs. We are not currently aware of any foundations that have funding right now for psoriatic disease. But these foundations might be an option for you if you have other health conditions, or if you are willing to check back in with these organizations regularly to see if more funding has become available. So I know that we just went over a lot of information, so please keep in mind that the Patient Navigation Center is here, and we are an ongoing resource for you if you have questions or anything comes up. These are some helpful links for commercial insurance and Medicare and Medicaid. And then these here are some resources on some websites that might be helpful in searching for coupons or other resources. I also wanted to let you know that you can request a copy of the slides from this presentation to be emailed to you. It would be helpful to have access to these links. So you can contact us here at the Patient Navigation Center. So I am going to open it up now for questions.
Great, thanks so much, Natalie. So our first question here, I'm taking Otezla and I'm on Medicare, working with a pharmacy. They say I don't qualify for assistance. Any ideas?
Yeah, absolutely. That is a great question. So we do hear about this often from people. So there are people who are on Medicare and they don't qualify for Medicare Extra Help, and they also don't qualify for a patient assistance program such as the Celgene Patient Assistance Program, which is the one for Otezla. You know, these programs are income-based, and so some people don't qualify, but there are still some things to think about. So one would be to request a tiering exception from your health plan, which we talked about a little bit earlier. So you or your doctor would submit a request for Otezla to be billed at a lower tier in your formulary. And so you can reach out to us here at the Patient Navigation Center if this is an option that you want to look into, and we could help you with some template letters. Sometimes these tiering exceptions are approved and sometimes they're not, but it might be an option you're interested in looking into. Another thing to consider is the Medicare donut hole that I discussed earlier. So if you're having that kind of high copay or coinsurance for your Otezla, it's good to know sort of that your cost might vary at different parts of the year, and that you would likely reach that catastrophic coverage fairly early in the year. So we found that many of the Medicare plan websites have a feature where you can put in your treatment and see what your cost would be for each month. And so, you'll notice that you'll see a big difference kind of during and after the donut hole in terms of costs. You can also call your plan and ask them to help you look into what your cost would be each month so that you can kind of assess, if Otezla is going to be an affordable option for you.
Great, thanks so much. Next question here. Can you explain to me how to afford Humira if insurance is bought on the exchange?
Sure, yeah. So if you are currently shopping for plans on the exchange, you can use the tool on healthcare.gov to look into which plans offer coverage for Humira. And then once you have a commercial health plan, and commercial health plans include plans that are bought on the exchange, and if you have a commercial health plan that has coverage for Humira, and if you have an active prescription for Humira from a healthcare provider, then I really encourage you to reach out to AbbVie, which is the company that makes Humira, and see about getting signed up for their copay card.
Great, thank you. Another question here. Our insurance carrier won't allow my husband to take an injection that works. Instead, he has to take another one they recommend. What can I do?
Yeah, so it sounds like you might be talking about step therapy, and this is where your insurance company requires that he try and fail another treatment before your husband would have coverage for the treatment that he and his healthcare provider have decided on or want him to be on. So your husband can work with his healthcare provider to submit an exception to this, making sure that his current provider knows about the treatments he's tried in the past, and if he's tried this treatment that he wants to be on and it's worked well for him, his doctor can certainly include that information in the letter requesting the exception. I would encourage you to go to steptherapy.com, the website that I showed you earlier, to learn more about step therapy. And then I'd also encourage you to reach out to us here at the Navigation Center, and we can help you look into your particular situation.
Thank you. Next question. What insurance is the best post-retirement?
Yeah, we definitely get that question often. The short answer is that, there really is no one best insurance plan that's best for every retired person. Everyone has different needs and uses their insurance a little bit differently. Most people who are retired are on a Medicare plan, but which Medicare plan best meets your needs is a little bit more of a complex question. So I really encourage you to spend some time shopping and comparing plans on, there's a Medicare plan finder, and it's a great way to kind of look at the various options and compare them, and again, kind of think about some of those questions I talked about earlier about how often you're going to be using your health insurance and what prescriptions you're trying to access. And then I also highly encourage you to reach out to your local SHIP program. So this is a free service that's offered by each state, and they provide counseling on Medicare plans at no cost, so they can also help you, look through your options and see what plans might be a good fit for you. And so their website to find a SHIP program is shiptacenter.org, or as always, you can reach out to us here at the Patient Navigation Center, and we will link you to some resources that can help you. I know that getting onto, retiring and getting a new insurance plan can be an overwhelming process, and so, we want to be here to support you in that process.
Great, wonderful. Next question here. I've been suffering from this skin disease for 10 years. Is there any free treatment?
So yeah, depending on your insurance situation, there might be some treatments available to you at no cost. One way to access free treatments is to enroll in a clinical trial. If that's something that you're interested in, we would be happy here at the Navigation Center to help you look into clinical trials in your area and see if any of them might be a good fit for you. Free treatment might also be available to you through patient assistance foundations, which I talked a little bit about a few minutes ago. So the eligibility for these programs will vary. So I'm not sure if in your particular situation if this would be a good option for you, but you would need an active prescription for the treatment from a healthcare provider. And again, a good way to start this process is to reach out to us here at the Navigation Center, and we can kind of help you look into those options.
All right, great. We have time for one more question here. What should you do if you go on a medication, it's approved by your PPO, and then in a few years you switch to Medicare?
Yeah, that is a really good question, and one that I think is a concern for a lot of people who currently have commercial insurance but will soon be on Medicare. The first thing is I think it's great that you're already thinking about this. And so when it's time for you to enroll in Medicare, there will be a few things to consider. So one will be shopping for a plan that best covers that treatment you're on. The hope is that one of the Medicare plans available in your area will have coverage for that treatment. You may also find that you would be eligible for a patient assistance program for that treatment. So there would certainly be a few things to kind of look into and see what your options are. I know that I just keep suggesting this, but I do suggest that people reach out to us here at the Navigation Center. It can be a really great start, if you're running into access issues or you're anticipating access issues like this one. We do talk to people every day who are going through similar situations, and we can find out more about your particular situation and help you talk through your options. So yeah, we are a free resource, and we are here whenever something like this comes up.
Great, thank you so much. We had a lot of great questions come in tonight. If yours was not able to be answered, like Natalie said, please contact our Patient Navigation Center by phone, email, live chat, or Skype. The information's here on the slide. And once you leave today's webinar, you'll receive a survey on the presentation, and we would appreciate if you can complete that and provide your feedback. As a reminder, our Patient Navigation Center is offering free health insurance quick guides, and you can get yours by following the link after leaving the webinar. Thank you again to our sponsors, AbbVie, Celgene, Janssen, Lilly, and Pfizer. And finally, I just wanted to mention that a recording of tonight's webcast will be available shortly on our website, and you can access our complete webcast archive by visiting psoriasis.org/webcast. Thank you, everyone, and have a lovely evening.